aching joints, stiff muscles, creaky bones. What's happening to our bodies during perimenopause and menopause? And more importantly, what can we do about it?
Welcome to Menopause Nurse Memos, empowering midlife one memo at a time, the podcast where we tackle perimenopause and menopause topics head on with honesty, empathy, and a whole lot of heart. I'm Vicky Ellison, a nurse for 33 years and an advanced menopause specialist nurse practitioner, an independent prescriber, and founder of Calm Menopause and Wellbeing Clinic based in Appley Bridge.
So, what is going on? Well, firstly, the hormone connection, which is the root of many of these issues, is the oestrogen, or fluctuations of it during the perimenopause and lack of it during the menopause.
Estrogen isn't just about reproduction, it also keeps inflammation in check, as it is an anti-inflammatory. It helps regulate collagen production, which is so important for joint support. It affects how our body responds to pain, and it impacts on bone density, keeping your bones strong during later life. As estrogen levels decline during perimenopause and menopause, these protective benefits begin to disappear, and that's when the aches and pains often begin. Some of the common complaints that many women describe are symptoms such as morning stiffness, that feeling that every joint in your body is stiff and painful until it gets going, often feeling like creaky gates. Sore hips, knees and shoulders are the main joints, but also wrists and heels. Particularly the problem of plantar fasciitis can be a common occurrence for perimenopause and menopausal women. Muscle fatigue, even without intense exercise, is a common complaint, and more joint cracking and creaking than ever before can occur. Random travelling pain that seems to move around the body. So does any of this sound familiar? Well, you'll be pleased to know you are not imagining it. So what is it? Perimenopause. Perimenopause is the transitional period before menopause. It can start in your late 30s or early 40s and last for several years. Hormones rise and fall unpredictably during this time. Whereas menopause is officially marked when you've gone 12 months without a period. But the aches don't magically stop there. They often persist or even worsen due to cumulative hormone loss over many weeks, months, and years. So why does it hurt so much? Well, let's take a deeper dive into this. The role of estrogen in joints and muscles is that estrogen helps reduce inflammation and supports synovial fluid, which is the lubricant in your joints. When estrogen levels drop, the synovial fluid dries up and the joints become less cushioned and more prone to inflammation. Think of it a bit like a car engine running low on oil. Collagen and connective tissues are affected by estrogen because estrogen also helps with the production of collagen, a key protein that keeps joints, tendons, ligaments and skin supple. So as estrogen levels reduce, collagen production is also reduced. Less estrogen means less collagen, meaning more stiffness and decreased flexibility. Muscle loss, or its medical term sarcopenia, starts in our 30s, where we gradually lose muscle mass, and perimenopause accelerates this. And less muscle mass means less support for joints, more fatigue and weakness, and an increased risk of injury. Also, bone density and osteoporosis can occur more commonly in women who have had an early menopause or entered perimenopause at a younger age. This is due to the reduced amount of estrogen that is produced. Estrogen is essential for bone remodeling. Without it, bones can become brittle and porous, increasing the risk of fractures and causing joints and bones to ache. Some women will have increased pain sensitivity. Studies have showed that estrogen has a pain dampening effect on the brain. So again, with reducing levels of estrogen, more women report having joint pains. With lower estrogen, the nervous system may become more sensitive to pain, making even minor aches feel worse. So, how do we diagnose what's normal versus what's not normal during perimenopause and menopause? Let's start with what's normal. Well, normal symptoms include mild to moderate joint pain, morning stiffness that improves during the day, general muscle fatigue. These usually come and go and are often symmetrical, which means affecting both limbs. But when should you see a doctor or healthcare provider? This is when it's not normal during the perimenopause and menopause. So, this should be if you are experiencing sudden or severe pain, swelling, redness or warmth, unilateral joint issues, that means only one side, and pain that worsens at night. You could be dealing with something beyond menopause, like rheumatoid arthritis, lupus, or even fibromyalgia. The overlapping problem is that menopause symptoms can mimic autoimmune conditions or chronic pain syndromes. So always speak up and advocate for testing if your pain seems beyond the norm. When it comes to treating aches and pains, firstly look at natural relief and lifestyle tips involving movement. So that's keeping moving, because it's so important that if you're sitting at a desk all day, make sure you get up and walk around often, or even by using standing desks. These can be hugely beneficial. Taking regular low impact exercise is key, such as walking, swimming, yoga or Pilates, and strength training. Movement increases joint lubrication, strengthens muscles, and improves circulation. Eating an anti inflammatory diet. Certain foods can either help or hurt. Such foods that can be helpful include leafy green vegetables, oily fish for their omega 3s, such as pilchards, mackerel, sardines, salmon, and fresh tuna, berries, whether they be fresh, frozen, or tinned, and turmeric and ginger, as well as olive oil. However, foods you should avoid or minimise include sugar and sugary foods and drinks, processed foods and ultra processed foods from the supermarkets, and excess alcohol. Stress management is important, as high cortisol levels, which are your stress hormone, increases inflammation and pain. So try meditation, deep breathing, journaling, and spending time in nature. And finally, having good quality sleep, because poor sleep increases pain perception. So prioritise good sleep hygiene by limiting caffeine and alcohol. Make sure the bedroom is cool, dark, and a sanctuary for sleep. And magnesium supplements or calming teas can help, or a 10-minute yoga flow before bed can help, as well as having no screens in the bedroom. Some other supplements to consider are vitamin D3 with a dose of at least 1000 international units daily, which in turn helps the body absorb calcium better. Magnesium, as mentioned before, omega 3 fatty acids, collagen peptides. So, bovine collagen is recommended for internal joints and bones, whereas marine collagen is more for improving hair, skin, and nails. And turmeric, particularly its active compound curcumin. This can be beneficial due to its anti-inflammatory and antioxidant properties. It may help reduce joint pain, swelling, and stiffness, and improves mobility in conditions like arthritis. There have been some studies that do suggest it can improve bone density. Some medical treatments that work. These include hormone replacement therapy, or HRT for short. HRT can be a game changer. It replenishes estrogen and can reduce joint pain, improve sleep, boost mood and energy, and help prevent bone loss. There are various forms of HRT, including patches, gels, and tablets. So speak to a menopause specialist who will give you the advice regarding estrogen and progesterone, and possibly testosterone. Other non-hormonal medications are available. So if HRT isn't for you, then you can consider non-steroidal anti-inflammatory drugs like ibuprofen for occasional flare-ups, SNRIs, which are antidepressants, or gabapentin for nerve-related pain, and topical creams like diclofenac or ibuprofen gel. Physiotherapy is an important treatment. A physiotherapist can teach you stretches and strengthening moves, improve posture and alignment, and offer pain relieving techniques. And finally, some other interventions such as acupuncture, which can reduce pain and improve circulation, massage therapy, especially for muscle tension, or chiropractic care for alignment and mobility. But remember, you are not alone. Around 50 to 60% of perimenopausal women report joint or muscle pain. It's one of the most under-discussed symptoms of this life stage. You are not weak, you are not making it up, you are simply going through a massive hormonal shift. So acknowledge if your pain is likely connected to hormonal changes, then you can rest assured you are not imagining it. Lifestyle changes can offer real relief, especially movement and anti-inflammatory strategies. And medical treatments like HRT and physiotherapy can be safe, effective options. You deserve to feel strong, mobile, and comfortable in your body at any age. If you are in pain, speak to your doctor. If they dismiss your symptoms, find someone who won't. Midlife isn't the end, it's the turning point. So until next time, be kind to your body. It's working hard for you. And next time on the podcast, we will be talking about brain fog during the perimenopause and menopause. Thank you for spending time with me today on Menopause Nurse Memos. If this episode resonates with you or you know someone who needs to hear it, then share and leave your comments in the chat. And don't forget to subscribe so you never miss an episode. Until the next time, take care of yourselves. You are worth it.